Okay, we are right in the hour of 2 p.m. Thank you so much, everyone, for joining. Good afternoon. My name is Mariam Lawan. I'm the National Coordinator for the National Girls in ICT competition. Thank you so much for joining. And with me here is Ibrahim. Please, can you unmute yourself to introduce yourself, Ibrahim?
Hi. Hello, hi. Everyone. Is National Day Activity. We should be very best of luck and this session. Thank you.
Okay. And thank you so much, Ibrahim, for the introduction. Please, can you mute yourself? Okay, thank you. So before we proceed, I would like us to have the national anthem. We healthy, our generative don't try but already, but in from the hood we stand. Nigeria is all and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. It's our battle honor, and this we count as gain. To our children, a banner without stain. O God of all creation, grant peace our one request. Help us to build a nation where no man is oppressed. And so with peace and plenty, Nigeria may be blessed. Thank you so much. Thank you so much, everyone. I would read the opening remarks now. So, good afternoon. Good afternoon, distinguished guests, judges, mentors, teachers, parents, and most importantly, our brilliant girls in ICT. It is my pleasure to welcome you all to the Southwest Regional Competition of the National Girls in ICT, a celebration of innovation, creativity, and unstoppable power of young girls in ICT. First, I bring you warm greetings from the Honorable Minister of Communications, Innovation, and Digital Economy, whose passion for girls in ICT continues to drive this powerful initiative. It is under his visionary leadership that we are creating platforms like this, platforms that empower, inspire, and ignite the potential of girls across Nigeria. Today is more than just a competition. It is a moment of transformation, a moment where girls from across the Southwest region of Lagos, Ondo, Oyo, and many more other states gathered to not only showcase their talent, but also to shape the future of technology in Nigeria and beyond. To every team here, you are already trailblazers, daring to innovate and to solve problems, as well as stepping into the world of technology. You are also breaking barriers and rewriting the narrative. Whether you take home the trophy or not, you are building futures, not just for yourself, but for your communities, for generations of girls to come as well. To our incredible mentors and teachers, partners, and all supporters, thank you so much. Your guidance and encouragement are making a lasting impact. As we continue today's competition, let us cheer one another. Let us celebrate excellence, collaboration, and courage. Let us remember the future of technology is diverse, it is inclusive, and it is boldly female. To all our Participants, go forth, shine bright, and most importantly, enjoy the experience. Thank you all, and let the competition begin. I hope you're all ready. I wish you all good luck. Thank you so much. So I would stop sharing my screen and call on the next team, the first team to present. So Ekiti State, are you ready? Ekiti State, are you ready? Okay, thank you. Great. So please unmute yourself and start sharing your screen. Hey.
Can you see our screen?
Yes, Team Ekiti. Thank you.
Good day, everyone. We are the Virtual Sisters, and today we are here to present Verimed, a drug authentication solution. Before I proceed, I would love to briefly share a story of a friend. There was one of my friends named Temilade. While we were in school, she experienced blurry vision. Then she went to buy eye drop from the local chemist not far from our hostel. After using the eye drop, she suffered irreversible damage. It got to the point that she had to go to the eye clinic to make complaints. She also went with her drugs, only for the nurse to scrutinize the label and see that there was no NAFDAC registration, an alarm sign of counterfeit risk of counterfeit drug. Temilade cried out in pain, but her eyes could not be returned back to normal.
Temilade's experience is not unique. In Nigeria, the widespread circulation of counterfeit drugs is a harsh reality. NAFDAC reports indicate that in certain markets, up to 40% of medicine are fake or substandard, putting countless lives at risk every day. This is our prevalence statement. Fake drugs are a major health crisis in Nigeria, with up to 30% of medicine in some regions being fake or substandard. Patients suffer from ineffective treatment, adverse reaction, and even death due to counterfeit drugs. Regulatory bodies struggle to eliminate and monitor counterfeit drugs due to lack of real-time verification tools.
So our solution, Verimed is a web app that allows anyone to scan barcode on drug packages and instantly verify authenticity. The real-time database check ensures accurate results. Also, user can report counterfeit drug, creating a community-driven alert system.
Then to how it works. This is our landing page. On the landing page, we have two options where we can scan barcode and also enter barcode. On the scan barcode, it's going to activate the camera and you look for the barcode on the drug package. Then you scan, it's going to show you the result, a tick check mark indicating that the drug is valid. And it's also going to bring out some details such as name, manufacturer, expiry date, and batch number. It's going to bring a cancel icon indicating that the drug is invalid. Then to the enter barcode, you are going to enter the number of the barcode on the drug package. You are going to confirm it to know maybe the drug is authentic or the number is correct or not. You're going to confirm it. Then you submit it. It's going to go directly to the NAFDAC. So we also have a reporting option to know maybe we also have a reporting option where you can report counterfeit drug. On the reporting page, you are going to insert the name, the issues, and the details. You are going to submit this and it's going to go directly to the NAFDAC to find a solution to the issues. We also have some features such as the About Us page, the Contact Us, where you can know very much about us. It doesn't end there. To make Verimed more distinct, we have some additional features, which include fake drug with location mapping,
Verified pharmacy and seller directory.
multi-language and offline mode.
Market opportunity. Over 200 million Nigerians rely on medications, but many struggle with counterfeit risk. The global counterfeit market is worth over $200 billion, affecting Nigeria significantly. Then the pharmacies and regulatory agencies need a solution to combat this growing issue.
Then to our business model, we have the freemium model, API licensing, partnership, and regulatory collaboration. Then we have four things that make us distinct. Our product is easy to use. It has real-time verification, scalability, and regulatory collaboration.
We also have some go-to-market strategy, which include the program planning, public awareness campaign, strategic partnership, then the app launch and scaling. Then we also have some roadmap, which include from the first month to the third month, we have the MVP development and testing. From the fourth month to the sixth month, there's There is the pilot launch with select pharmacists and regulators. Then from the 6th to the 9th month, there's nationwide rollout and API expansion.
This is our financial projection. We have some 3-year potential, which is estimated revenue 70 million naira, expenses 40 million naira, estimated profit 30 million. It increases as the years goes by. Why do you have to join us? Verimed is more than a tech innovation. It's a lifeline for millions at risk from counterfeit drugs. With a clear emphasis to like Tenlade and robust real-time data, our fish speak to both the human and technical side of this critical issue. We invite you to support this initiative and be a part of the transformative change in Nigeria healthcare system.
Join us in the fight against counterfeit drugs and help save lives. Thank you.
Well done, Team Verimed. Thank you so much for the wonderful presentation. Judges, the floor is yours if you have any question or comments for the girls. Judges, any question, comment, or feedback? Okay.
Hello, everyone. No questions from my end. Just a well done to the girls for the presentation.
Okay, thank you so much for the wonderful presentation, Team Verimed. I would like you to please stop sharing your screen and we'll call on the next team. Thank you. So Lagos, Team Lagos, are you ready? Team Lagos, are you ready? Okay. I guess Team Lagos is not ready. So I would like to call on Team Ogun. Team Ogun, are you ready? Team Ogun, I can see you on the call.
We are coming, ma.
Okay. Mhm.
The video. Baptist Girls College. Baptist Girls College innovators. Providing for some focus. Baptist Girls College innovators providing sustainable solution to quality education through gamified learning and virtual reality. My name is Radhika Sarah Modupeluwa. My name is Shonam Blackfetter. My name is Shokala Aisha Karike. And we are all BGC innovators. Have you ever struggled to understand a subject like mathematics, science, or history because it felt too difficult or boring? Yes. Imagine learning about space by actually traveling to the moon in a virtual world. What if, instead of reading historical events, you could walk through it as if you were there? Today, we are going to show you an amazing way to learn that makes studying fun, interactive, and super cool through virtual reality and gamified learning. Traditional learning is not fun enough. Raise your hand if you have ever felt bored while studying. Some subjects are hard to understand because we can't see or experience them. Many students memorize for exam instead of actually learning. The question, who has ever wished learning could feel like playing a video game? Furthermore, what if learning felt like playing a game? With virtual reality, you can see, hear, and feel the subject come to life. You get to explore a virtual world and interact with learning. Gamified learning makes study fun with rewards, challenges, and puzzles. The system adapts your learning speed to make lessons easier and more challenging. You learn with your friend in a shared virtual space. Wouldn't it be amazing to learn biology by visualizing the human body?
The market opportunity is huge. The edtech industry is expected to reach $114.5 billion by 2025, and the integration of virtual reality in education is growing at a rapid pace. We are seeing an increased demand for personalized learning. Mindspark VR fills that gap by offering affordable and scalable solutions. Additionally, Mindspark VR has the potential to reach low-income regions by providing accessible virtual reality solutions. Target audience, school owners, parents, teachers, educators, secondary school students.
Our business model is simple and scalable. We are focusing on business-to-business model where we offer subscription to schools, educational institutions, and government education bodies. We also have a freemium model for students with core lessons free and premium content available for purchase. We plan to partner with hardware vendors to provide affordable VR headsets and opportunity for schools to integrate Mindspark VR. This will help us reach more students and ensure that schools are fully equipped to use Mindspark VR effectively. Now let's take a look at the competition. There are several players in the edtech space, but what sets us apart is the integration of virtual reality and gamification. Our platform offers immersive, interactive learning experiences that traditional e-learning platform or virtual reality only apps can't provide. Front-end development, we use React.js. Back-end development, we use Node.js. Virtual reality development, we use Oculus SDK. Game development, we use Unity 3D.
We've already achieved some significant milestones. We are working on the prototype, minimum viable product development. We have onboarded 4 innovation hubs in Ogun State with ongoing partnership discussions with private schools in Ogun State. We will then run pilot tests with 3 schools to gather feedback.
So what's next for us? Our immediate next step include forming partnership with Ogun State Ministry of Education, Science and Technology and Federal Ministry of Communication, Innovation and Digital Economy. Onboarding 3 more innovation hubs, establishing our free-out library, and organizing a free-out demo day for schools in Ogun State. Mindspark impact, enhance critical thinking and problem-solving skills, improve retention and understanding, increase students' engagement, and bridging the digital divide.
Imagine identifying a woman anatomy without actually having an encounter with the body. Your organs, Thank you for the time and attention. With Mindspark VR, we aim to transform the way students learn, making education more interactive, immersive, and accessible for everyone. We invite you to join us in creating a future where every student has the opportunity to truly experience learning. Learning should be fun. Mindspark VR, we can make it.
The future of learning is here. Let's step into it together. Thank you.
Thank you.
Okay, well done, girls. Thank you so much for the wonderful presentation. Judges, comments, feedback.
Okay, good afternoon. So here's from Harrison. By the way, very wonderful presentation, and you girls are doing very well. I love your solution. So just a comment, because from the way you presented, it seems your solution is targeted to a particular region, a particular state, a kind of. So if you eventually make it to the final stage, God willing, maybe you need to look into your pitch deck and, of course, try as much as possible to expand it to be able to serve more people aside the people of the states that we came from. Yeah. So that's the only comments from me. And kudos, guys. You guys did well.
Thank you, sir.
Thank you so much, judges. For team, please, can you stop sharing your screen? I would like to call on the next team to be ready and start your presentation now. Okay. Team icons.
Yeah, video.
Team icons, are you ready?
Yes, ma'am.
Okay. Your time starts now. Start sharing your screen. Good luck.
Good afternoon, panel of judges. I am Inyolua Oni, and here with me are Timlolua Adeyoju and Aliyah Olani. Together, we're making a mobile application and wristband tracker to locate and rescue kidnapped victims called Contract. So what problems are we facing now? First of all, loss of lives and properties due to kidnapping, insecurity of road travelers and tourists, and also requests for ransom for kidnapped victims. So what would be our solution? To create a mobile application that provides emergency alerts and serves as a location tracker to help locate and rescue kidnapped victims within Nigeria.
Here is our MVP, Contract, your security power. Your best smart security option. Contract brings you advanced security technology that keeps you protected in any situation. Our cutting-edge AI and IoT system ensures rapid response and immediate notification for your peace of mind. Here's a sample of our wearable wristband and our app icon. The services will be rendering are as follows. Individual emergency tracking, going for a sum of 2,500 Naira. Family setup, going for a sum of 10,000 Naira. School safety program, going for a sum of 10,000 Naira. To book, you'll be asked to fill in your personal information with 2 other emergency numbers so as to ensure normal tracking. As Contract, we are dedicated to revolutionizing personal security through innovative technologies. Our mission is to provide a proactive safety net for travelers, individuals in high-risk areas and educational institutions.
Our target markets. Firstly, we have water and land travelers. Secondly, tourists. And thirdly, people living in an insecure environment. Our business model and revenue model. We have 2,500 Naira per month subscription. For individuals who won't be able to afford the yearly subscription, can buy into this subscription method, which is just 2,500 Naira every month. And 20,000 Naira per year subscription. For people who can pay for a full year, have this opportunity or this option of paying the sum of 20,000 Naira. Our SWOT analysis. Our strengths, we have AI-based solution, security agency support, and school support. Our weaknesses, we have financial weakness and lack of required gadget for project execution. Our opportunities, we have national recognition and investment from previously rescued victims. Some victims who this app has worked for can support us, which can also help in the efficiency of our app. And our threats, we have competitors and lackadaisical attitude of security agencies. Some security personnel in Nigeria have negative attitude to work, which can hinder the efficiency of our app. Once again, meet our team, Timlolua Deborah Hadeyoju, Oroluwa Aliyah Holani, and Hinioluwa Goodness Uni. In conclusion, we're happy to be a part of the Girls in ICT program as to boost the efficiency of our project, Team Contract.
Okay. Thank you so much, girls, for the wonderful presentation. Judges, any question?
Not a question. Okay, a question. What state are you representing, please?
Ondo State.
Ondo State.
Ondo.
Awesome presentation, by the way.
Thank you,
Thank
ma'am.
you, ma'am.
Okay, thank you. So I would like to call on the next team. Team Zion, are you ready? Ocean?
Yes, ma'am.
Okay. Your time starts now.
Mariam, sorry, which team was this one which was presenting? I just wanted to mark. This was the BGC innovators. No, the
No,
icons.
no,
Sorry.
icons.
Icons.
Yeah.
Got it.
Good day, everyone. My name is Faria Gunjoy, and with me are
Afolabi Mary
and Olanipepanlia. We are from Kidvac High School, Ibe, Osun State, and I'm the team lead of Zion. We're introducing to you Viva, an app that provides early detection and better protection to users. As we all know, according to the World Health Organization, rural areas face significant healthcare challenges, including according to the World Health Organization, 27% of global malaria cases, which is about 68 million, and 31% of malaria deaths, which is about 194,000, were recorded in Nigeria in the year 2021. While during the COVID-19 pandemic in the year 2020, Nigeria recorded over 200,000 cases and over 3,000 deaths, most of which are avoidable if individuals are empowered to take control of their health, identify potential risks earlier, and access personalized care and support. The COVID-19 pandemic and consistent malaria cases played a major role in inspiring us to create Viva, as they exposed the weaknesses in our healthcare system, highlighting the need for innovative solutions. The name Viva was derived from the combination of the two words, vibrant and revive. Vibrant represents a person who is healthy and needs to stay healthy, while revive represents a weak and sick person who needs to regain his or her strength. The idea for Viva was born out of the urgent need for accessible, real-time, and preventive healthcare solutions in both rural and urban areas. As we all know, rural areas face significant healthcare challenges, including inadequate medical infrastructure, shortage of healthcare professionals, and long travel distance to clinics, while urban communities are faced with issues like pollution, lifestyle diseases, and overcrowded health facilities. This disparity leads to preventable illnesses, increased healthcare costs, and higher mortality rates, emphasizing the urgent need for accessible, avoidable, and sustainable health solutions. In order to solve these problems, we have created Viva, an app that utilizes artificial intelligence to analyze data from wearable devices and detect potential health issues early. Users can input their symptoms, and our innovative solution enables instant analysis and guidance. Users can also connect with health professionals remotely on our app. Our system provides real-time updates on disease outbreaks and alerts users to take preventive measures. Our system also provides health information and education in multiple languages like English, Hausa, Yoruba, and Igbo, ensuring that users from diverse backgrounds can understand and manage their health effectively. Viva bridges the gap between patients and healthcare providers, reducing hospital congestion and improving overall public health. Introducing Viva. The key features of Viva includes
AI symptoms checkers. User simple symptoms and AI provide possible disease prediction and their preventive measure. Telemedicine and virtual consultation, which allow users to be connected with health professionals anywhere and anytime. Real-time epidemic and disease alert. These enable users to get real-time information about epidemic and disease outbreak in a location with their particular time and their safety measure. Wearable device integration. These are smart devices or gadgets, such as smartwatches, fitness band, health trackers, that will be synced with the app to perform physical checkup, like pulse rate, blood pressure, heart pressure. And this allows the doctor to record the life update of the users during live consultation.
How does Viva works?
Fiverr works in a way that when Fiverr works, a user has to input it or a user has to register on the app and set up a profile. In order to gain access to the content of the app by creating an account, inputting health history, and adding family member for collective health management. Then the users begin to interact with the app basic functions such as AI-powered symptoms checker, telemedicine and virtual consultation, e-prescription and pharmacy integration through digital prescription, sent to partner pharmacy with option for home delivery or local pickup, health monitoring and wearable device integration, community health and awareness, which provide educational resources, blogs, and health alerts to keep users informed. Insurance and microfinance integration, which provide access to affordable health insurance and finances for medical expenses, and also offline mode for rural users through USSD, SMS, and IVR-based assistance for non-smartphone users. Here are some of the companies playing in our sectors, and what make our app different from other apps is that we make use of AI symptoms checker, epidemic alert, and wearable device integration.
Here are some of the strategies we put into place to generate revenue through this app.
Sponsor health campaign and advertisement. We'll be offering branded health educational content in collaboration with sponsors. Subscription-based health service. We'll be partnering with employers to offer the employees health package. Based on our subscription package, we have the family package and the employers package, in which we have the free version users and the premium users. The free version users are the users that does not subscribe to our app. And so they didn't get full access to our, but only get access to AI symptoms checkers and pharmacy. Whereas the premium users get full access to our app, by which they subscribe to our app. They get full access to telemedicine and virtual consultation, AI symptoms checkers, wearable device integration, and real-time epidemic and disease alert. And also our partners will also subscribe to our partners like pharmacy stores, different health professionals, microfinance banks, and so on. So this allows us to know the numbers of transactions being made through our app, and in which in return they'll pay commission based on each transaction being made, either weekly, monthly, or yearly.
Our target audience include the local community and the urban community. The total available market, which is equivalent to the Nigeria population, is $3.3 billion. And the serviceable market, which is the same as the smartphone with internet access, is $1.5 billion. And the obtainable market, which is the same as the remote consultation demand, is $300 million.
Here is a brief update on our progress. We've completed our feasibility study, onboarded all our partners, while the design and development of this app is ongoing, with the pilot launch expected to be done by September 2025. Over the next few years, we'll be expanding our operations to new regions, increasing our reach and impact. Our first phase will focus on establishing a strong presence in Osun State by December 2025. Building on our success in Osun State, we will expand our operation to the Southwest region by December 2026. This will increase our reach and impact and position us for further growth. With a solid foundation in the Southwest, we will launch a national expansion plan, bringing our service to the entire country by September 2027. As we solidify our position in Nigeria, we will set our sights on Africa, expanding our operation to meet the growing demand of the continent by February 2030. Our marketing strategy is designed to drive concentrated growth in Osun State, followed by strategic expansion to other cities in Nigeria. To achieve this, we will leverage the power of influencers, engage in better community reach and digital marketing, prioritize user engagement. We also partner with the Federal Ministry of Communication, Innovation, and Digital Economy, and with the non-governmental organizations. We are seeking 50 million naira pre-seed funding in order to turn our visions into reality. The allocated fund will be utilized for infrastructure and our operation, marketing and user acquisition, team expansion, and research development. Let me quickly show you a prototype of our app. Here is the splash screen, which introduces the app. You click on Get Started, which brings you to the login page. You can either log in as an existing user or sign up as a new user. As a new user, you sign up with Google, your phone number, or Apple. Here is where you create your profile by inputting your date of birth, your gender, your height, and your weight. If you have any existing medical conditions, you can also list them here. Here is the menu screen. Okay. Here is a place where you can get real-time information on disease and epidemic alerts in a particular location. Vival encourage your daily well-being and also provide health tips by which you can stay healthy. Here is the home page where we can interact with our Vival AI-powered health assistant. It provides symptoms analysis and health insights based on available data. Mind you, it does not replace professional medical advice, diagnosis, or treatment. If you experience the first symptoms, make sure you seek immediate medical attention. For your convenience, here is the menu screen where you can interact with other functions of the app. You can either choose your doctor, find the pharmacist, save for emergency, or connect with wearable devices. Here is where you can book appointments with a medical practitioner, and the last screen is where you confirm the appointment. Once again, meet our team. My name is Fari Gunjoy, Team Lead Viva.
Afolabi Mary, Innovation Manager, Viva.
Olanipekan Leah, Research Lead Viva.
Thank you.
Hey, thank you so much, girls. Well done for the wonderful presentation.
Very good presentation, team. I had a very simple question, right? You in the last slide, you had mentioned the breakup of the seed capital that you would require, right? Assuming you get 10x of that money, right? Because the idea is very scalable. What would you do with a 10x money, right? I'm just saying that you just go into direct scale up, right? Will you spend on marketing? Will you spend on product?
So please come again.
I'm saying if you ask, I think 50 million Nigerian currency, if you get 10x of that money, instead of 50, you get 500, right? How would you want to spend that? What would be your priority areas in terms of scale up of your product?
The money will be spent on the development of the app.
Development of the app. Okay. Okay. Thank you.
Very well done, team, for the wonderful presentation. Thank you so much, judges. And I would like to call on the next team to present, which is team Oyo AI Health. Oyo AI Health, please, for the Oyo AI Health. Are you ready?
Yes, ma'am.
Okay. Start sharing your screen. Your time starts now. Good luck.
allow oncologists to detect cancer without exposing their patient data. Key features. It is easy to use. It is available offline and locally. And also, you can get prediction in seconds. And also, continuous training is available to improve accuracy. Unique selling points. It is faster, it is more affordable and more accurate. We've achieved over 80% accuracy in cancer detection, surpassing Detect A and Pathfinder. Market analysis. There are over 120 cancer treatment centers in Nigeria with limited AI integration. And also, there is shortage of radiologists and oncologists. Target market. Our target market focuses on hospitals and patients. Revenue model. Our revenue model is subdivided into two: subscription-based and transaction-based. Another subscription-based, hospitals pays us 5 million naira each year for licensing and training of their staff to use our system. Another transaction-based, if diagnosis costs 10,000 naira. Financial projection. At the end of year 3, we are targeting to generate about 1.6 billion naira in revenue. User acquisition plan. We would partner with Federal Ministry of Health, onboard more facilities, and expand cancer testing services. And we will launch campaign about awareness of importance of cancer testing. Our roadmap. In the first 6 months, we will be launching to 20 hospitals, and after 12 years and above, we will be launching to over 120 hospitals all across the nation. Thank you. Once again, permit me to introduce Joy to demo the project.
Thank you, Blessing, for giving me the opportunity to demonstrate this project. So this is PictoBlocks, a no-code open source solution. And here are the segments. We have LD breast and LD breast. As an oncologist, watch me upload this EKG scans with cancer. So here are these EKG scans. So we can see that this patient has 96% LD and 4% un-LD. So from the look of things, we are able to see that this patient definitely has. So watch me upload the one without cancer. So this is the one without cancer. We can see that this patient is 90% LD and 10% un-LD. So we can see that this patient does not have cancer. Together,
let's conquer cancer. Thank you.
Very good presentation, team. Simple question. How did you arrive at this idea of working on a solution on cancer?
Come again, sir, please.
I'm saying, how did you arrive at this thought of building something or thinking about something that is on cancer, for example?
We build this using PictoBlocks so that everybody can have the access to it.
Okay. Okay.
Thank you, sir.
Thank you.
Team AI Health, well done. I would like to call on the Lagos Real Crew. Team Real Crew, are you with us? Lagos Real Crew, are you with us? Please react, or if you are struggling to unmute, send a message in the chat so that we know whether you are with us or not. Lagos Team Real Crew, we know you are real. Please unmute yourself if you are with us. Okay, going once, going twice. Sold. So I guess we have come to the end of the competition for the day, and we'll give judges 10 minutes to analyze the data and tell us the winner. But before the judges leave, let's snap a group picture. So please, if you can all on your cameras and say cheese. Yeah. Okay, one. Good. Judges. Kin Plus Technologies, Ikiti State. We want to see you. Dr. Adesola, are you with us? Juliana, Opolo Global, Peace House. Please, can you, on your camera, Peace House, Ikiti. Okay. Okay, one, two, cheese. Okay, good. Thank you so much. So the judges, you have 10 minutes to review and announce the winners while we listen to music. Thank you.
We run this mother. We run this mother. We run this mother. We run this mother. Who run the world? Girls. 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 Who run this mother? Who run this mother? Take your check, come at the neck. It's what take the snow they won't. Boy, I'm speaking truth. Boy, I'm speaking truth. It's the time and night. Here's the text. Can build a nation in this power. The love we can devour. You'll do anything for me. Who run the world? Girls. 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 Who run the world? Who run the world? Get hot up and hit the take, don't be scared to run it back. For the girls are taking over the world, we raise the flag, but time it's grab. But it was wrong, it is up to know what time it is. You can't tell me no, I got my 9 to 5, but I'm my share. It's good up to water, when I get dirty, you want to go out the window. So please accept my shine, boy. How we want it, not to fight, things are strong enough to fail. Children, then get back to business. Can build a nation, endless power. Some love we can devour. Do anything for me. Who won the world, girls? 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 Who won the contest? Who won the contest? Stop tonight. I lost another fight. Let the battle just start again. Falling down, one head in the ground. I always had not be with me. Birds don't just fly, they fall down and get up. Nobody learns without getting it wrong. I won't give up, no, I won't give in until I reach the end, and then I'll start again. Oh, I won't leave. I wanna tell you the thing I wanna tell, even though I can fail. I won't give up, no, I won't give in until I reach the end, and then I'll start again. No, I won't leave. I wanna tell you the thing I wanna tell, even though I can fail. When it comes, you fill your heart with love. Maybe you're not enough. Take a deep breath. Don't beat yourself up. Don't need to run so fast. Sometimes we come up with little best. I won't give up. No, I won't give in until I reach the end, and then I'll start again. No, I won't leave. I wanna try everything. I wanna try even though I
Judges, I will say jaldi jaldi. Judges, how is it going? Is it difficult to pick one? Girls, you've seen how remarkable you have done that it's difficult for the judges to decide. This shows you have done an amazing presentation and work. Thank you so much to the volunteers and everyone that has supported this activity. Judges?
Yeah, we just ended the discussion, right? Who would want to do the honors?
I think Harrison should do it.
Harrison, you want to do the honors?
Yeah. Harrison, are you with us? Okay, Juliana, do you want to do the honors? Juliana? Okay. I guess Himanshu, everyone doesn't want to be the bad news bearer.
I'll
Okay,
do
I
the
can
honors,
see
right?
Juliana has unmuted, so Go ahead, Juliana. Please on your camera and go ahead. I think it's a network glitch. So, Himanshu, go ahead because time is not on
I'll
our
do that.
side.
I'll do that. First of all, I think congratulations to everyone. I think this is the fourth sort of presentation or set of presentation we did yesterday, two presentation today morning we did one. I have not found any group right where the difference between the winners, the second, the third, and the fourth was so narrow. Trust me, the difference cumulatively, the winner, whoever the winner will be, and I'm going to announce, will be winning with decimal points, right? So not even full points difference between the winner and the second. Just to sort of for my thing, the winner has got 34.5 on an average, and the second runners up or the first runners up has got 33.9. The second runner up, which is the third team, has got 31.5, right? But any which ways, a tough job, but we still have to declare one as the winner. So the winner for this session is Virtuous Sisters, right? So can we have a round of applause for the Virtuous Sisters? Right, right. Well done. Well done. You see all the happiness.
Oh, so my dear, you are wonderful.
Mariam, I would have
Congratulations.
loved to sort of be in Nigeria for the finals to meet all the
Oh,
7 teams.
yeah.
Unfortunately,
This is such a joyous moment. I will enjoy it on your behalf. I'll enjoy
sure,
it on
sure,
your behalf.
sure.
Thank you so much.
Sure.
Well done,
Thank
girls.
you, team. All the best. Right. Thank you.
Okay, thank you everyone for the wonderful presentation. Thank you so much, judges, for your immense contribution to this activity, and also to all the volunteer hubs that have supported this competition. I guess you have really done an amazing work. You have done a very good work. All of them have presented really well. So well done. Thank you so much. And we look forward to seeing you at the national competition in Abuja on the 30th. So hopefully we would start seeing you from 28th, inshallah, of this month. So have a
Thank you.
good, yeah, have a good weekend. Thank you. Bye. Bye.
Bye.